crows! Shoo! Shoo! Shoo!
Whoa, bird attack.
That is not a worm!
Poor Homer, oh my gosh. Fire breathing gone awry, radiation exposure, and the best tonic is chronic? What? Get ready to laugh because today we are back at it breaking down all of the absurd medical scenes and ridiculous injuries from one of our faves, The Simpsons. All right, let's dive right in.
Why, you little burn, party burn!
Holy cow. When we have somebody who comes to the hospital who has any type of burn to basically your face, we always look for these like singed hairs, soot in your nose, soot in your posterior pharynx, so the back of your throat, because then that gives us an indication that it actually went into your airway, increased risk of swelling, increased risk of basically losing your airway.
Tongue will be in that cast for a few weeks. It may put something of a cramp in your lovemaking.
I don't think I've ever wrapped somebody's tongue in bandages like that. It's really hard to keep on. The moisture still stays around. It doesn't stick.
No, it won't. If he wants me to do something, he'll just write it down.
Oh my gosh, that sound, the sound of the cast cutting saw. It looks scary, it looks crazy. You think it goes in a circle, really vibrates in like a very specific way.
Got it.
Oh, was aggressive and ripped it off, but you can actually see on the cast that there was a cut on the top and a cut on the bottom.
Well, at least I can eat again. Cherry.
So I would definitely not, after having a massive injury to your tongue or the oral pharynx, jump right into eating something, even just sugar.
The fire burned off your old taste buds, exposing new ones.
It's almost like peels that we do to our face, right? When people get chemical peels to the face to remove like a layer of the tissue on top, kind of the same idea here when it's relating to injury to the tissue of the tongue, that then it wasn't a deep enough burn to cause permanent damage, but deep enough to where now it required new cells to regrow. Is that a Geiger counter? What is that? Is that for like radiation?
Can't lift arm or speak at normal rate.
Well, I'm afraid you have a case of acute radiation poisoning, Mr. Socha.
When somebody says they can't move one side of their body or they behave in such a way, the first thing we always think about is a stroke, obviously. Now, radiation exposure, very rarely do we ever see types of radiation exposure, but it can wreak havoc on your body.
Be able to play softball tomorrow.
It's never good when you actually have a really bad medical experience or diagnosis and the doctor is laughing, especially if you're not laughing and it's a not laughable moment.
No, by tomorrow you'll barely be able to breathe.
Oh my gosh. So if that's actually the case, in certain circumstances, we would actually intubate early to prevent you from stopping breathing and work on figuring out how this radiation poisoning is affecting your body. It could definitely be deadly. You can have symptoms within a few hours. It's ruining your DNA. It's breaking it down.
Ken Griffey Jr. needs to see you immediately.
The other thing that they don't really address here is this person had radiation exposure. That individual needs to be decontaminated. So then everybody around the patient does not subsequently get further radiation exposure.
We think it's an overdose of nerve tonic.
Good Lord.
Whoa.
Gigantism.
So gigantism is what I know it as acromegaly, and it typically occurs more in the pediatric adolescent population, and it has to do with pituitary abnormality and pituitary tumor, where growth hormone is basically made secreted.
Stupid crows! Shoo! Shoo! Shoo!
Whoa, bird attack.
That is not a worm!
Poor Homer, oh my gosh. Okay, you gotta worry about different birds, could potentially harbor different types of microorganisms, pathogens that you have to worry about that can cause infections.
Ow! I hate getting stitches in my eyes. Stupid crows.
Don't be mad at the crows, Homer. They weren't trying to blind you. They were just trying to drink your sweet, sweet eye juices.
Sweet, sweet eye juices, aka aqueous, vitreous, the fluids of the eye. Isn't this doctor just a normal, regular doctor? I would not touch anybody's eyeball when it comes to sewing it back together. You want an eye surgeon, like a specialist related to the eye. The eye is so complex, so no, we wouldn't even mess with that. Even if the eyelid is lacerated, there's so many complications that could occur that you want a specialist to take a look at it.
Well, there is a medication, although it's a little controversial.
Does it go in the butt?
I'm talking about medicinal marijuana. Prescription
Oh.
pot. Texas THC.
Look, man, I don't do drugs.
The taboo conversation of THC. I work in California, so it's a little bit more open to talk about. There's actually medication that has actually been made for people who have certain types of epilepsy relating to THC and CBD.
But isn't marijuana or dope illegal?
Only for those who enjoy it.
Dope, marijuana, we actually just pretty much call it cannabis. Cannabis is still a Schedule 1 substance on a federal level in the US. But every country is different and even states are different. Oh my gosh.
Okay, let's see. Toke as needed. Caution, objects may appear more edible than they actually are.
Cannabis, it increases the possibility of having what we call the munchies or wanting to eat food. And that is actually why one of the major reasons they use it in medicine is it helps with nausea as well as stimulation of eating food for people, specifically like cancer patients, because of the medications that they're given.
Do ya? Do ya?
Oh! Oh! No! Whoa, 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 whoa. It's like a horrible nightmare. You worry about just a swing. The swing you can get caught on. A lot of times more there's like fracture dislocations are the most common. And then you're thinking trampoline. Trampoline injuries are mostly like ankle fractures, dislocations. We see those all the times, especially with all these trampoline parks that are out there. But it's horrible that we're seeing like a river of blood coming out the other end. We're not seeing any tissue, thank goodness. Oh, I spoke too soon. There's tissue coming out like slices of a ham where there's the bone in the middle. Oh my gosh.
1, 2, 3. 1, 2, 3. Oh.
There's different types of CPR depending on your skill level and where you are. But the first go-to is hands-only CPR. But if it's just the heart, it's not going to work. But I will tell you, I've done CPR many times where the heart is exposed because we've cracked open the chest and literally somebody's heart is in my hands and we're actually doing CPR.
It's no use.
Oh, okay, Homer, that was kind of nice. So we actually do close the eyes, not just when somebody actually dies. If I'm doing, say, an intubation or any type of procedure and I'm sedating an individual, we'll actually do our best to close your eyes. And even in the operating room, they may put a piece of tape on your eyes to keep them closed. It really serves a couple purposes: keeping your eyes from getting dry, which can cause issues, and then making sure that they're shut so you don't actually get a cut to your eye. This is so entertaining, very interesting, a lot of fun. If you guys enjoyed that, definitely check out this playlist right here. Check out everything in that, binge watch it for me, and do me a favor, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.